Hello, Grace. Can you take a seat in my office and get comfortable?
Yes, thank you.
No problem. Now, I see you're worried about the birth of your child. May I ask how far along you are?
I'm currently 13 weeks pregnant. I've heard that there are increased risks in birth defects in children born to older mothers, myself being 45.
Well, Grace, the risks are significantly larger for more mature women. About 1 in 35 women over the age of 44 are at risk of giving birth to a child with Down syndrome, since the egg's quality lessens with age.
That's what I'm most concerned about.
There are 3 types of chromosomal patterns that result in Down syndrome. They are trisomy 21, mosaicism, and translocation. 95% of people with Down syndrome have trisomy 21, which is an extra 21st chromosome in each cell. Mosaicism is when a faulty cell division occurs after conception, resulting in some cells having 47 chromosomes instead of 46. It occurs in only 2% of all cases. In translocation, a part of the 21st chromosome actually breaks off and attaches itself to another chromosome, usually chromosome 14. Translocation occurs in only 2 to 3% of all cases.
Oh wow. Could any of these types of Down syndrome be inherited from me or my husband?
Down syndrome is neither a dominant or recessive genetic disease. It happens when the creation of a sperm or egg cell, a process called meiosis, does not occur properly. However, in translocation, about 2/3 of the separations occur spontaneously, while the rest are inherited from a parent. In this case, it is essential that you and your husband have your chromosomes analyzed if you plan to have another child, as the chances of having another child with Down syndrome are greater.
I heard that you can't physically tell if a newborn baby has Down syndrome. Does this change much with age?
Although at birth there may not be obvious differences, as the child grows you will notice that they will have larger cheeks, large round eyes with an upward slant, a larger tongue, smaller limbs, a flat nasal bridge, low muscle tone, a short neck, a single deep crease along their palms, and a small body frame.
Is Down syndrome only a physical difference? I mean, what are some health concerns that I should be prepared to handle?
Children that are born with Down syndrome face health complications beyond the usual childhood illnesses. More than 40% of children have a congenital heart malformation. However, this does not mean that they will become seriously ill. Hypothyroidism, when the thyroid gland does not produce enough thyroid hormone, is also very common and can be easily tested and treated for. Many children have some form of hearing loss due to frequent ear infections and require constant checkups to make sure that their ear canals are clear. Vision problems are another issue. An ophthalmological exam would be required during the first year. On a more positive note, people with Down syndrome have a lower risk of having hardening of the arteries, damage to the retina caused by a complication of diabetes, and most kinds of cancer. Are there any mental disabilities I should be aware of? People with Down syndrome usually have mild to moderate mental retardation, but cognitive ability does vary from person to person. Children with Down syndrome often have a speech delay and require speech therapy. In addition, their motor skills are delayed. They may not walk until age 4, however some walk as early as age 2. Although their abilities are less than that of a normal person, it is common for people with Down syndrome to go to schools, camp, and hold jobs.
So they can lead normal lives like you and I?
Of course they can.
I'm just worried that my child will end up being called names like Mongoloid if he or she does have the disease.
Mongoloid is an unfortunate title for the disease. Down syndrome was first discovered in 1866 by Dr. John Landon Down. He noticed that a group of children at his home for the mentally retarded all appeared to look like people from Mongolia, hence the term Mongoloid. I wouldn't worry though, society is much more accepting now than they were in 1866. Plus in 1970, the disease was officially named Down syndrome.
Is there any way you can test for Down syndrome?
Yes, you can do screening or diagnostic tests. Screening tests are less invasive and cost-effective. However, they do not give definitive answers. Diagnostic test is 99% accurate at detecting Down syndrome and other problems, but there's an extra risk of miscarriage, fetal injury, and preterm labor.
What are some other available tests?
The first screening test is a first trimester combined test, which includes ultrasounds and blood sampling. The ultrasound is done to measure a certain area around the baby's neck, also known as a nuchal translucency screening test. When abnormalities are present, more fluid than usual tends to collect in this tissue. Results of the ultrasound are paired with blood tests that measure levels of pregnancy-associated plasma protein A and a hormone known as chronic gonadotropin. Abnormal levels may indicate a problem with the baby. You can have full integrated testing, which is done in the first 2 trimesters of your pregnancy. The results of the previous test and another blood sampling test for high levels of alpha-fetoprotein, estradiol, and inhibin A are combined to estimate the risk that your baby has Down syndrome. This test can achieve the same level of detection as the first trimester combined test, but with a lower false positive rate. If your screening tests are positive or worrisome, you might consider diagnostic testing to confirm the diagnosis.
Amniocentesis is when a sample of the amniotic fluid surrounding the fetus is withdrawn through a needle inserted into the mother's uterus.
This sample is then used to analyze the chromosomes of the fetus. Doctors usually perform this test after 15 weeks of pregnancy. This test carries a 1 in 200 risk of miscarriage. Another type of diagnostic test is chronic villus sampling, where cells are taken from the mother's placenta and are used to analyze the fetus's chromosome. It is typically performed between the 9th and 14th week of pregnancy and has a 1 in 100 risk of miscarriage. After amniocentesis and chronic villus sampling are completed, the samples are analyzed using a cryogenic test called fluorescence in situ hybridization, or FISH. Although it doesn't look at the actual structure of the chromosome analyzed, FISH analysis can tell you how many copies of a particular chromosome are present. In Down syndrome, the cytogeneticist uses probes for the number 21 chromosome.
If there are 3 fluorescent signals seen under the microscope, then the diagnosis of Down syndrome is
For
made.
certain syndromes, we as genetic counselors look back at a medical history of a parent's family using a diagram known as a pedigree to help predict the probability of a child inheriting the syndrome. However, since Down syndrome cannot be inherited, a pedigree is not useful, and therefore testing is the only means of diagnosing the syndrome.
What if I don't have the testing done until after the baby is born?
Down syndrome can be diagnosed after a child is born through blood and tissue sample that is stained to show chromosomes grouped by size, number, and shape.
So if I do have the test done, what do I do when I find out the results?
You will have the option for termination, adoption, or continuing the pregnancy.
What if I don't have the testing done until after the baby is born?
Down syndrome can be diagnosed after a child is born through blood and tissue sample that is stained to show chromosomes grouped by size, number, and shape.
This test is called a chromosomal karyotype and can determine if the child has an extra 21st chromosome.
So if I do have the test done, what do I do when I find out the results?
You will have the option for termination, adoption, or continuing the pregnancy.
I'm so conflicted on whether I want to pursue the testing at all. There's so many different aspects to take into consideration. What if the test results came back positive? Would I even want to know? Knowing if my baby has Down syndrome would allow me to prepare myself for what lies ahead. At my age, this is the only chance I'll get at having a child. I'd be able to educate myself and my family on what we're going to have to be dealing with. But if I carry out the pregnancy, my child will be dependent on me for his or her entire life. I don't know if I can give the type of love and care my child would even need. Knowing would allow me to decide if I want to go through with my pregnancy at all. Down syndrome would have a negative impact on the quality of the life that my child would lead. I don't even know if I'd be able to handle the trauma of an abortion. Would my family support my decision? I know that my church would not. Not knowing whether my child has Down syndrome would be equally as stressful. I'd feel extremely anxious and unprepared. The chance that my unborn child might carry a terrible disease would always be on the back of my mind. Good or bad news, I'd have to feel strongly enough that I'd be a great parent and love my child no matter their differences, not letting a test dictate the value of my child's life. I've seen the heartbeat. I know that he or she's alive. I just don't know if the life that my child would lead would be even worth living at all. What should I do?
I understand your dilemma, Grace. Unfortunately, as a genetic counselor, I'm unbiased, and therefore cannot make any of your decisions. You must be the one that decides what happens next.
What have other people done in my situation?
The vast majority, about 90% of people, terminate their pregnancy.
Thank you. You left me with a lot of information to think about.
I'm always available if you ever need any information.